it's Dr. Wellwood here at the Natural Health and Regenerative Medicine Clinic, your local Spokane area chiropractor. One of the questions that I'm going to talk about today on the Daily Dose is, or concerns anyway, that I seem to get a lot in my office. I don't know if it happens everywhere else, but it happens here at least. Is a person will come in and they'll say, you know, doc, I blew out my knee about 4 or 5 months ago. Now I'm starting to have some lower back pain. Could those things be related? And I'm here to tell you today that yes, they can be. There's some really interesting research that came out in the beginning, the end of last year in December, for I think it was the Journal of Sports Medicine, or what was it? Let me say. Medicine and Sports and Exercise in December 2017. That's what it says here. That actually showed that 70% of soldiers who were studied who have acute lower back pain or new onset of lower back pain basically also had a prior injury to a foot or ankle or hip. So in other words, you have about a 70% chance of having lower back pain if you had an ankle or foot or knee condition in the past. So if you're having weird sensations down in your lower back and you've never had back pain before, but you blew out your knee last year, well, it makes sense. And why does it make sense? Well, for one, if you're having to walk and one side is limping because it was in pain, it throws off the entire musculoskeletal balance system. So what we call a key movement pattern. So your body has to compensate. In order to compensate, it spasms up one side and relaxes another side, and then you start moving funky. And over a period of time, that funky movement actually causes increased wear and tear, that causes inflammation, that causes more muscle spasticity, and that causes back pain. So that's how that actually occurs. I also had somebody in this morning who basically owns the local pizza parlor, and I adjusted her neck, and she wanted to know why I adjusted her neck when she was having some lower back pain. Well, the same thing basically is that oftentimes when a person has neck pain, they will also have lower back pain. And she actually didn't tell me she had neck pain. She just says, well, would that explain why I'm always having back or neck pain when my lower back goes out? Yes, it does. If your spine is here and your lower back is out, where does that make your neck? It's out too. And it's going to cause muscle spasms all the way over here. You're just going to go like this, and then, yeah. Anyways, so basically any type of alteration in movement or activity is going to cause compensation somewhere else, and that's where we're going to have pain at. So that's your daily dose. Hopefully you found some good information in there. It might explain some injuries or some pain that you're having, and I'll talk to you soon.